every doctor, medical student, and educator in this room. Balancing personal well being with the relentless demands of the medical field is no easy feat. And today we have the privilege of hearing from some of the most experienced voices who have walked this path and shaped it with their wisdom. We are absolutely honored to have with us an esteemed panel of experts, each bringing their own unique perspective and wealth of experience to this important conversation.
Please join, please join us in welcoming Dr. Aparna Tavte ma'am, our beloved anatomy tutor and inspiring educator. With over 23 years of teaching experience, known for her passion and unwavering commitment to student learning.
Next, we have Dr. Shanu Srivastav ma'am, Professor of Pathology and our counsel in charge, whose guidance, leadership and constant support have played a crucial role in shaping the academic and personal journeys of countless students.
We are also joined by Dr. Girish Karmarkar, a director of DAMS Mumbai, a respected academic mentor who has been instrumental in guiding and preparing medical aspirants all over the country through years of teaching and mentorship.
And last, but certainly not the least, we welcome Dr. Amit Agrawal, Associate Professor in the Department of Obstetrics and Gynecology. He is a dedicated OBGYN specialist with MS and DNB degrees of fellowship and laparoscopic infertility and a keen focus on pregnancy, management and family planning procedures.
We are truly excited to learn from each of you. Today, without further ado, let's begin this enlightening discussion. Good morning everyone. Let me start with a simple question. When was the last time a doctor slept for 8 hours, took a full Sunday off, ate lunch without being interrupted by a phone call? For many, the answer is they don't remember. In a profession that is synonymous with sacrifice, where life and death are part of your daily vocabulary, where duty often replaces desire. We ask today, can doctors truly have a life outside their scrubs? Or is work-life balance just a buzzword we whisper in HR meetings and forget the chaos of casualty? This morning, we have with us a powerful panel of doctors who have lived this reality, felt the stretch, the burnout, the guilt, and maybe even the hope. Let us hear from the frontliners.
Let's start with the basics and maybe the hardest question of them all. How do you define work hours in a profession where emergencies don't wear a watch?
In a profession like ours, work hours aren't defined by the clock but by commitment. So when these work hours begin when our duty calls, and the boundaries between the personal time and professional responsibilities are often a blur.
So ma'am, do you think the life outside medicine is a luxury now or was a myth?
Life outside
Medicine is a luxury.
life outside medicine is a luxury. You know, when I see others, I feel yes, they are enjoying. Yes, it's a luxury. But if I see myself in that place, I am more comfortable with my work, my slides, my patients. I cannot accept that kind of luxury, you know. Like if you have a pizza to eat, you know that it's not good for you. Nevertheless, you know that it's good.
Indeed, ma'am. This isn't just a local problem, is it? Just how bad is it out there, sir?
See, if you see global stage, out of all the professions, the work hours for medical profession are the maximum as compared to the engineers or the architects or the bankers. The doctors everywhere are working for more hours every week. In UK, 80% of the doctors, they complained that they are having no work-life balance. The other day, my friend from UK, he had come, see the contradiction. My friend from UK, he had come and he said that absolutely there is no work-life balance in my life. And when I asked him in details, he said, yeah, twice a week he goes for tennis, twice a week he goes for swimming. In spite of that, he says that there is no work-life balance. 90% of the doctors in US, they work for around 51 hours per week. But the scenario in India is even worse. Indian doctors, on an average, mostly the clinicians, they work for more than 60 hours a week, and that is too much of a workload. Now, in this case, I'm not talking about the residents. Are there any residents over here? Most of you are still students, but when you become residents, you will realize that residents are never treated as humans. These work hours, and they don't apply to residents. 36 hours at a stretch, 48 hours at a stretch, without sleep, without proper food, is a norm, and these things have to change.
Okay, so then what happens when we burn out? What's the price we pay for saving others' lives when risking our own?
So, as sir rightly said, the working hours are not fixed. Being a doctor, even if it is 60 hours or 70 hours, you cannot predict that which 60 hours you are going to work. It's not like कि आपने 9 बजे गए और 5 बजे आपका काम खत्म हो गया. It's not like that. It may be that night में 12 से 4 आप काम कर रहे हैं, and then again you have to work from 9 to 4. So definitely there is burnout, and that burnout leads to stress, anxiety, and a lot of times you skip your meals, and you basically you ignore your own health in treating patients, and sometimes more than treatment, the counseling takes a more time to deal with the patients, because being a gynec, I can tell you that counseling is a bigger part of the management nowadays. Now patients have different queries. They will read from Google. They will tell you. They will ask you 10 questions from their disease. And ultimately, when you are anxious, you are not eating well, you are not sleeping well, your definitely judgment will definitely affect, and you start misbehaving with the patients, your anger issues, your frustration, and basically you lose the communication with the patients. So definitely it is hampering the treatment that we are doing. So the work-life balance has to be very, like, जितना हो सकता है maintain करना चाहिए.
It's starting to sound hopeless. But tell me, ma'am, what can we actually do? Are there real strategies, or are we just managing the chaos?
Yes, there are strategies, and but it will be a long time before it can be implemented. The strategy I feel is that we should have more number of competent doctors. The word competent is very important. Just employing doctors, seeing their degree, there are a lot of doctors who are unemployable. And as senior persons, if you have such people working under you, they are there for the name, but you cannot rely or countersign on that. So I think we should produce very good number of employable, knowledgeable doctors. Unfortunately, in India, we are having more candidates getting UG admissions in the same number of colleges, and therefore the teachers are overstressed to make them really competent. So here the responsibility lies on the students to learn their subjects, to become competent doctors, understand and not just bug up. And this is one message to all those students who are present here. See, whatever knowledge you gain, it should be by understanding, seeing the patient. Even if you don't see the patient, at least imagine that this is leading to that and that is leading to what. So that when you see a patient in any stage, you identify the disease, rather than learning the subject only as a multiple choice question or a long answer or a short answer question. So my answer is, we need competent, good doctors.
Also, do you think that does technology hurt this or help with this?
Technology, actually it is like a double-edged sword. It should be used well. In pathology, we have automation, and if this automation is under a pathologist, it's an adjunct. But if it is not under a pathologist and reports are just issued out from a laboratory, then it is hazardous. So AI should be used, technology should be used, but in the proper setup, in the proper place. And it should not be employed for commercial use.
What about having a support system? Does it really make a difference?
Yes, that is my favorite part actually. When you have in a demanding profession like us, to have a support system is very useful. We need it. I mean, if somebody comes and tells you, "Hey, you look tired," or let us talk. You want to talk about it. So it helps a lot for us to get through this. So you need a very good support system to back you up, and that is important after you become a doctor as well as in your student life. So I see a lot of first year students sitting over there. So I suppose I play a certain amount of role in being your mentors. I hope. Do you agree with me?
Yes.
So I try to be as helpful to them as much as possible, not only in academics but other parts of life also. So I think support system is very important for us to get through this challenging situation.
Okay, now let's talk about the bigger picture. What can hospital systems do to the very ones that that benefit from the overworking doctors do to fix this?
Now, the onus lies with the institutes uh, to maintain a very good environment, working environment for the doctors. Now, this might sound very hypothetical in our Indian setup or Indian scenario, or it is too early to implement this. But these changes should take place. There should be predictable work hours, duty hours for the doctors. I know this is very impossible in our scenario because what is happening is over here is according to the management principle, if you require 100 people for doing a job, the institute employs only 90. And then you consider almost 10% of absenteeism. So almost 80 to 85 people are doing a job of 100 people. Now this mindset has to change for corporate hospitals especially, where instead of what they do is instead of 100 they employ 90 and they try to exert the work of 100 people from 90 people. Ideally it should be 110 people should be employed for a work of 100 people. Now this mindset has to change in the corporate hospitals. Another thing is you should be giving counseling centers. Now doctors are a community which are overworked, and especially there is more Nari Shakti now in our setup where there are more women doctors. You should make provision for creche and certain family counseling centers for these female doctors. Apart from that, doctors are the people who are having more ego and they will not accept. The acceptance has to come for the doctors that they have some mental problem. And for this, we need to set up the counseling centers in the hospitals for the doctors. Now we have counselors for the students everywhere, right? From the schools we have counselors for the students. But there are no counselors for the working staff in the hospitals where it is required the most. And that's why we should be having counselors. And first thing, doctors should accept that they have some problems. Nowadays, accepting a problem has become a fashion. Since Deepika Padukone first declared that she has taken therapy, and recently Amir Khan has said that he also takes therapy. So now the acceptance has increased. So this acceptance should increase. Counseling centers should be there for all the faculties as well as the working staff. And these are the changes that the hospital administration should be doing.
And Amit sir, what kind of leadership do we need at the top?
So leadership basically means not a person who is just going to lead you. It actually, as Madam said, the leader has to be a good support system for the hierarchy that he is leading, and he has to listen to the employee that he is working with. So a good leader is one who listens to everyone and then try to solve each one's problem at whatever he can do to it. And being a doctor, we are a part of the department. So in our department also, we see to it that each of the faculty and each of the doctors who are working, they are in a good space of mind to work, because they have to decide in a critical situation. So until and unless you are in a good frame of mind, you are in some kind of toxic relation in the department, some ego, some thing is going on in your mind, then that decision making, and which is very much important in critical situation, that is definitely going to hamper. We cannot avoid it. So leader's role is to make peace in the working environment and be open to everyone to come to him for discussing.
Let me ask one more question. What happens if we don't solve this issue? What do you think? Would just leave it.
Okay, if you don't solve this issue and there is no work-life balance, um, talking as a doctor, it leads to something called a fogging of the mind, where the mind is not clear to take decisions, there is no clarity of thought, and the mind cannot prioritize the work. Doctors have to take decisions in a lot of ways, depending on the speciality of that personal doctor. Honestly telling you, if I see a histopathology slide, Dr. Amit would know that, and it is a difficult slide. If I see it after 2 o'clock or 3 o'clock, and I'm forced to write, they want us to give diagnosis on gunshot. And I say, okay, before releasing, I'll see once more in the morning. I realize that I missed something. So that is because of overwork, no balance. We also need to be happy, yeah, come on. Why not? Let us have less work and be paid equally.
One more thing which I would like to add is like for this, what is very important is like when you go home from work, you have to put a clothes. There should be a shut-off button. Like you don't take your work home and you don't bring your hassles from your home to your workplace. So that is the beginning of a good this. And previously I said I am a support system to my students. In the similar way, my students from all the batches, I'm talking till I've worked for so many years, my students are my backup. So they provide one sort of a support system for me. So if I'm not in a good mood or if I'm disturbed that day, once I start teaching, I forget about it. It is because of the students. So the credit goes to them also.
You are our favorite anatomy professor. As we walk out of this hall into the rest of today, let's carry more than just notes. Let's carry this truth. Work-life balance isn't indulgence, it's insurance. Insurance for our doctors, insurance for our system, and insurance for our future. It's time we stop glorifying exhaustion and start humanizing healthcare.
Thank you to all our panelists for your control, your courage, and your commitment. The world may not always thank you, but this morning we do.